Hello everyone, I'm Travis Satchko, registered nurse and home care manager at Cold Lake First Nation Health Services, and I'm here today with our nurse practitioner, Mary O, to talk about cancer awareness. Mary, did you know Cancer Awareness Day, World Cancer Awareness Day, is this February 4th, this Saturday?
Actually, I did know that, Travis, and this year's goal of the World Cancer Awareness Campaign is to close the gap in cancer recognition, treatment, and testing. So this gives us a great opportunity to discuss cancer screening. So we know over the last few years, people have struggled with getting in to do their regular screenings, mainly due to COVID. So we want to close the gap in our knowledge and understanding of cancer. We want to help people understand more about why we need to do our routine screenings.
Absolutely. I would like to start with a few facts about cancer that people may not know, such as cancer being the second most common cause of death worldwide, second only to cardiovascular disease. 2 in 5 Canadians are expected to develop cancer during their lifetime. So that's quite a stark figure if you look around a room when you're out, and saying that 2 out of 5 people are in that room are going to be having cancer in their life. So cancer can occur at any age. However, it does affect those over 50 years old most often, and our risk definitely increases as we get older.
Yeah, definitely getting older is an increased risk or greater risk for developing cancer, and that we can't really do much about. No. But what are some other risks that we should be aware of?
Yeah, for sure. Age is what we would call a non-modifiable risk factor, or those things you cannot change. This would include getting older, like we had mentioned, being male or female, depending on the type of cancer. Also having a family history of cancer and genetic risk factors. You're kind of got what you're born with there, so too much you can do about that. And sometimes environmental risk factors come into play that you don't have no control over either. So now on the other hand, we also have modifiable risk factors. So those are things that you can change or modify. And I think a lot of us would be familiar with some of those with lifestyle. Things like adding daily exercise to your routine can lower those risk factors. Controlling your body weight, adding lots of fruit and vegetables to your diet. Another one would be limiting alcohol to no more than 2 drinks a week. And then not smoking is a big one to reducing your risk for cancer there, Mary. And just to note that 40% of cancers are linked to these modifiable factors. So we do have a lot of say in that as far as, adjusting what risks we have to getting cancer there.
Yeah. So there are a lot of things that we can do to reduce our risk of cancer.
Absolutely, yeah.
Yeah. Unfortunately, people think about cancer as one disease. People say, I want to prevent cancer. And I think a lot of people are unaware that cancer is actually more than about 200 different diseases. And so essentially it's an abnormal dividing of the cells in our body, and they just get out of control.
Yep.
And of course, the general risks that you talked about, those are good ways to prevent cancer and reduce our risk. However, we also have some great screening and guidelines out there that we want to talk about too. And we use those to identify those people who are at risk and help early detection, because 1/3 of cancer-related deaths could have been prevented if people had that screening and early detection.
Yeah, I mean that's a big number, right? That's why screening and early detection are so important.
Yeah.
So maybe let's discuss some of the more common types of cancers that we can screen for. One type of cancer that we see a lot of awareness campaigns for, and everybody else probably aware of this, is breast cancer.
Absolutely, yeah. And I wear my breast cancer ribbon and my pink shirt today.
Absolutely.
Because of
On
breast
the job.
cancer.
Yep. So what can women do to screen and protect themselves from breast cancer?
Yeah, absolutely. Breast cancer is so common, and it's so common that it's the second leading cause of cancer death in women, next to lung cancer. And I always tell women you need to know yourself. So you should check your breasts on a regular basis if you notice anything unusual, some lumps, some things that aren't as they usually are. Then it's a good time to have that discussion with your primary care provider and come in and talk to us about what's going on, and we can see whether screening is meant for you.
Right.
But did you know that, Travis, there's been a new change in Alberta for our screening guidelines for that first mammogram?
Oh, okay, yeah. I did hear something about that there.
Yeah.
So can you enlighten us and let everyone know what these new guidelines?
So these are guidelines for women across the whole like all around Alberta, and regardless of what's going on. So these are women who don't have breast symptoms, and just making sure that we're checking and make sure you don't have breast cancer.
Yeah.
And so these guidelines, back in the day, they used to screen all women at age 40, and then they changed it to age 50, and now they've decided we're just going to meet in the middle and we're going to start at age 45. So all women should be starting their first mammogram at age 45 now, and doing it at least every 2 years until they're 74.
Okay.
Yeah. So this may change if you have a family history of breast cancer, or you found a lump, or there was some abnormality on a previous mammogram.
Yeah.
So you might have to go a little more often, and some women we start screening a little earlier. So again, that's a reason to have a good discussion with your family care practitioner.
Right. So a good point to follow up with your primary care provider, right? Would be recommended to have that discussion with them.
Yeah. So when we think about men, a lot of men come in and they have concerns about prostate cancer. So what do you think men should know about this common cancer?
Well, prostate cancer, as we speak, accounts for about 20% of all new cancer cases, Mary. 10% of cancer-related deaths in men are from prostate cancer. I know that these rates are higher in other types of cancers that are out there, but it's still important for men to be aware of prostate cancer and the signs and symptoms, right, to what to watch out for. So these signs and symptoms would include like strong and sudden urge to urinate, difficulty with urinary flow or controlling your bladder, or new onset of pain down there. If any of these symptoms are present, then as before we'd mentioned, then you should have a discussion with your regular care provider for sure.
Absolutely. Yeah. And as you said, not all men are tested for prostate cancer, but having that discussion with your care provider is important. And then there'll be some decisions made as to what tests or procedures need to be done. So if testing was chosen, what kinds of tests and procedures would men have to expect?
Well, I'm sure as all men's probably biggest fear is the whole physical exam thing with the rubber glove. But, you got to take into account your health is what's important here, right?
Absolutely.
So often there is a physical exam by your care provider, but there's also a blood test that may go along with that. And based on those findings and results, sometimes a specialist also needs to be involved.
Absolutely.
Yeah.
So that's really good information. And of course, men are encouraged to follow up with their primary care provider, have that discussion. If there's anything going on that's unusual, then make sure that you get that checked out.
Absolutely. Another common cancer that of concern for women is cervical cancer, Mary. What are some of the things we should know about this common cancer for women?
Yeah, so cervical cancer is caused by the HPV virus. So that's the human papillomavirus. Right. It's a warp virus. And we do know that this is spread through sexual activity is most common. Right. So we do have routine screenings. So women know these as the Pap test. And it's very effective at detecting those changes or being able to see if HPV is present. Right. And that would give us concerns about turning into cancer. Yeah. So the guidelines have changed over the last few years. And currently, the guidelines in Alberta are that women would start their first PAP at age 25 or 3 years after the initial start of sexual activity, whichever is longest. Right. So that would mean that if a woman starts sexual activity at 16, she still wouldn't get her first PAP until she's 25. Oh, okay. And then the recommendations are to continue with your PAP every 3 years until you're aged 69.
Oh, wow.
Yeah.
Okay. Well, I mean, and there is a preventative vaccine now for that HPV, that virus, right? Yeah. So the virus is known to cause cervical cancer, and so we have this vaccine.
Absolutely. Isn't that great? HPV vaccine is recommended for both females and males between the ages of 9 and 45. And so the Alberta immunization program right now gives that vaccine in grade 6 to all boys and girls. Wow. So that's great. We're getting those kids covered. So then if you're still within that 9 to 45 year range, you might be thinking, well, I'd like to get the vaccine. Unfortunately, it's only covered up to age 26. So if you're in that age range and you did not get it in school, then most certainly reach out and we can get that vaccine for you. You still could get it after that age. Unfortunately, it does cost some money. Yeah. So at this point in time, you could still have that discussion with your primary care provider or pharmacy, but there is a cost attached to that. Okay. But there is hope that in the future, we wouldn't have to worry about about HPV-related cervical cancer, cervical cancer at all.
Yeah, absolutely. I mean, that'd be amazing, right?
Yeah.
A vaccine that could prevent cancer, and who knows where else that could go, right, with other cancers.
Absolutely.
So,
So it'd be wonderful for women not to have to worry about that. But of course, in the meantime, continue to have those discussions with your primary care providers. Start your PAPs at age 25, continuing to age 69. And typically it's every 3 years unless there's other discussions.
Good advice.
Yeah. So another common cancer that we deal with and we screen for is colorectal cancer.
Yes, absolutely. Colorectal cancer screening. We used to have every person over the age of 50 go for a colonoscopy. And I'm sure everyone's heard of this test procedure. But if you've had one of those, you know it's not a fun test to prepare for. It's not an actual test, but the preparation, that's not the fun part.
Exactly.
So I'm sure everyone knows, right, Mary?
Yeah.
So now it's a little different, right?
Mm-hmm.
So it's not just a colonoscopy. We actually have a simple poop test.
Yeah, and I brought one here today. So this is what the actual FIT test looks like.
FIT test, yeah.
Yeah.
Fecal immunochemical test, or FIT for short.
Absolutely.
So this little test is recommended every 2 years, starting at the age of 50 until the age of 74.
Absolutely. And I'm just going to pull it apart while you're talking here so people can see.
Yeah.
So simple.
This test looks for signs of bleeding that could be worrisome for cancer, and a positive FIT test would indicate that you need further testing with a colonoscopy. So, and just to note there, that's not what you actually have to provide your poop in.
Yeah, no. You just
there is a process for that. So just in case it looks worrisome.
You just take this little thing and you dip it in. And you put it back in here. You bring it back to the health unit. We send it in. Looks for signs of blood, which could be worrisome for
Much
cancer.
simpler than a colonoscopy prep, right? And then if it need be further, then so be it. But
absolutely,
it screens out a lot of potential.
And that way only the people we're concerned about now go for the colonoscopies and have to do that really horrible prep.
Yeah, that's right.
So it's good. So this is really good information for people to know about the screenings, what's available routinely. Mm-hmm. And I think, at the bottom line, it's really good to know about your body and how your body feels. So if you notice changes, it's a good time to make that appointment, to do that follow-up with your primary care provider and discuss your concerns. And that way we can explain them, we can examine, we can go further into testing if needed.
Exactly. Like if you feel something different, like changes in your stool or in your urine, increased tiredness, and we're talking about, changes that are different than the norm of what you're used to, what you're usually feeling like all the time there, right? Yeah. So you know your body best. You know when something's different, right? Everyone does. So, unusual aches and pains, you should get a checkup. As well, people should not forget to check their skin for unusual lumps, right? And then also bumps, sores, or growths, right? That's very important.
Yeah. People sometimes forget to check their skin.
Yeah.
So
take it for granted.
Exactly. Did you know it's a good idea to check your birthday suit on your birthday?
Oh, well, that's a good way to remember to have a good look at your skin at least once a year, right?
And if you have a spouse or a partner, they usually have a different birthday. So that's 2 times a year. You get to help each other out.
Oh, I might
so
write
it's
that
a
down.
good way to remember. Yeah.
So what things should people look for when they're doing that check, Mary?
Absolutely. So we'll show a little diagram of what to look for. But this is something that I remember because I need mnemonics to remember things. So we go by the ABCDE rule.
Okay.
So when we're looking at some kind of lesion, a mole, lump, bump, something on your skin, we look at it for asymmetry. So that's our A. And so basically if you were to draw a line either up and down or across, and you're looking to see if it looks the same on either side.
Right.
If it's looking a little weird and wonky on one side, not the other, we should take a look at that.
Right. Yeah.
And then B is the borders. So are the edges of this lesion looking really rough and ragged? That's something to be concerned about. If they're nice and smooth and crisp, that's great. That's no worries.
Yeah.
And then C is color. So moles can be of different colors. You can have blue ones, pink ones, purple ones, that's okay. But if you have multiple colors in there, not such a good thing. Okay. And then D is diameter. So diameter is how big is that actual lump, bump, mole, whatever it is.
Yeah.
And so we're looking about 0.5 centimeter. Or I even brought a pencil. So pencil eraser.
Oh, yes.
Right?
Okay.
My finger's about the same size, but not everybody's is.
No.
But a pencil eraser is the size that we're looking at. And if it's bigger than that, that's something to get looked into.
Yeah.
And then last is evolution. So evolution is, how is it changing? So if you've had something that's kind of weird and wonky, and maybe some of the other rules apply to it, but you had it since you were a kid and it's never changed, it's good, that's okay.
Yeah.
But always check that and make sure it's not changing.
Right. Change is something different, something changing, right? Get it checked, right?
Absolutely.
Those are excellent tips to know and how to check our skin for skin cancer there. So, well, you know what, Mary, there's so many cancers out there, right? We could probably do a few podcasts about them.
Absolutely.
Yeah.
Yeah.
It definitely makes.
Yeah, and the main message that we wanted to get out there today is that if you haven't already had a discussion with your primary care provider about cancer screening, any changes you've had, that kind of thing, this is a good time to celebrate World Cancer Day or World Cancer Awareness Day to have those discussions and think about those preventative type screenings, catching things early. And just having those regular cancer screenings done are so important.
Yeah, they're there, they're available. Make sure you follow up if you notice that something has changed, something different.
Absolutely. Yeah. Well, thanks for having this discussion with me today.
Absolutely.
And thank you everyone for tuning in and learning more about cancer, cancer screening, how to protect yourself.
Yes, and hopefully we've been able to close the gap on our knowledge about cancer and screening to meet the goals of World Cancer Awareness Day this Saturday, February 4th.
Absolutely. And if you want more information on cancer, you can go online to the Alberta Health Services link myhealthalberta.ca or the Canadian Cancer website at cancer.ca. Or come in and have a discussion with someone on your health team. Come on over to the health unit. We'd be more than happy to have that discussion with you.
Absolutely. Well, that's all for today. And we thank you all for joining us and stay healthy.